Anderson. So I am Nurse Kristine. How are you both feeling today?
Good morning. I don't feel really good today.
We're really trying to stay positive.
I understand. I know that this is difficult time for both of you. So I am here to discuss the next step and explore options for your comfort and care moving forward.
What are the options, nurse?
Given the progression of your stage 4 lung cancer, which metastasized to your bones, we have a couple of paths that we can take. So first, we can pursue aggressive treatment, which may include chemotherapy, radiation, or targeted therapies. So this can help manage your symptoms, but may you come with significant side effects.
What are the chances of success of these treatments?
While this treatment can sometimes slow the progression of the disease, they are unlikely to cure it at this stage. So another option we can have is the palliative care. Palliative care can focus on improving Mr. Anderson's quality of life, and it could manage his pain and other symptoms.
What does palliative care involve?
So the palliative care involves a team approach to support you physically, emotionally, and spiritually. It also includes pain management, it could relieve your symptoms, and it can assist in your daily needs. The goal is to keep you as comfortable as possible.
Will it mean that he needs to stop fighting the cancer?
Not necessarily. Palliative care can be provided alongside the treatments for the cancer, but it prioritizes the comfort over aggressive interventions. So it's about making sure that you both can spend quality time together without even being overwhelmed with the side effects of those treatments.
Quality time sounds good. I'm tired of feeling sick all the time.
It's completely understandable. So many patients find that palliative care gives them a better quality of life. So we could tailor all your care plans that you can have your specific needs and wishes.
If I want him to be comfortable, I want us to have good days together.
And that's entirely possible. We'll work closely with you and your family to ensure your needs and wishes are respected every step of the way. So do you have any questions or concerns that you want to discuss further?
I think palliative care is the right choice for me. I want to enjoy the time I have left with my family.
We'll do everything we can to make that happen, and let's get started with your personalized care plan. Good afternoon, Mr. Johnson and Mrs. Johnson. I am Nurse Kristine. How are you both doing today?
To be honest, I've been thinking about my situation lately.
He mentioned some things that are really concerning me.
I'm here to help you through this. Mr. Johnson, what's on your mind?
I've decided I want to do a do not resuscitate order. I don't want any life-saving measures to be done to me.
But honey, your advance directive said you wanted everything possible done to keep you alive.
It's not unusual for people to reconsider their wishes as circumstances change. So, Mr. Johnson, can you share more with us about what led you to this decision?
Honey, I've been feeling tired lately and in a lot of pain. I want to pass peacefully.
This is too hard for me to hear. We agreed in everything being done to save you.
These are incredibly tough decisions. So advanced directives provide guidance, but they also make space for changes if a person's feeling evolves.
I don't want to go through any more aggressive treatments or resuscitation. I really want peace.
I'm scared. We planned to fight together. I don't want to lose you.
It's clear that this is a very emotional situation for both of you, Mr. Johnson. Your wish for a DNR or do not resuscitate is significant, and we need to honor your voice.
I know it's tough, but I don't want to bear the thought of suffering.
I don't want you to suffer either. But I thought we agreed to fight until the end.
It's important to balance the patient's current wishes with their previous directives and your wife's concerns. So we can bring in additional support, such as an ethics committee or a counselor to help navigate this.
That sounds a really good idea. I just want to make sure that my wishes are followed.
I want what's the best for you, honey, even if it's hard for me to accept.
We'll arrange a meeting with the ethics committee and get the counselor involved, and this will help ensure that Mr. Johnson's current wishes are respected and provide support for the both of you through this difficult decision.
Thank you, nurse. It means a lot to have this support.
We'll get through this together. I'm here for you no matter what.
And we're also here to help you every step of the way, so you remember that you're not alone in this. Good afternoon, everyone. So thank you for coming. I'm Nurse Kristine, and we're here to discuss Mr. Davidson. Mr. Davidson is a 68-year-old palliative care patient who recently had a stroke. So Mr. Davidson has complex care needs that include system management, activities of daily living, psychosocial support, and medication adjustment. So I'll start with an overview of his condition. Mr. Johnson's stroke has resulted in significant left-sided weakness. So he's experiencing pain, dysphagia, and occasional confusion. His primary symptoms are managed, but he reports moderate to severe pain that is not fully controlled with his current medications.
Thank you, Nurse Kristine. I'm Mira, the social worker, assigned with Mr. Davidson. Psychosocially, Mr. Davidson is quite distressed. His wife is overwhelmed as she is his primary caregiver. They have limited social support and are struggling financially. Mr. Davidson is also showing signs of anxiety and depression, which could be exacerbating his perception of pain.
Good afternoon, everyone. I am Meryl, the pharmacist assigned to Mr. Davidson. From a medication perspective, Mr. Davidson is on several drugs, including anticoagulants, antihypertensives, and his pain medications. I've noticed potential interactions that may be contributing to his uncontrolled pain and confusion. His pain relief protocol might need adjustment to address these interactions while maintaining his safety, especially considering his dysphagia.
Thank you both. To summarize, Mr. Davidson needs more effective pain management, supports also for his activities of daily living, and elevation of his family's caregiver burden, and also a possible adjustment to his medication regimen to reduce the interaction. So let's start with the pain management aspect. Pharmacies, what changes would you recommend?
Considering his dysphagia and drug interactions, switching his pain medications to a long-acting opioid patch could provide more consistent pain control. We might also add a low dose of anxiolytic given the presence of anxiety and depression, but we should monitor it closely for side effects.
That sounds reasonable. For activities of daily living, Mr. Davidson also requires assistance with bathing, dressing, and mobility. So I'll arrange for more home health care needs. We also need to prevent skin breakdown to his immobility.
I can work on connecting his wife with respite care, services, and support groups. It's critical that she gets some relief. Also, I'll explore financial assistance programs to help alleviate their financial stress.
Excellent. Moving forward, I'll document the plan and make the necessary referrals for increased aid hours and skincare management. Pharmacies, can you handle the medication adjustment and follow up on their effects?
Absolutely. I'll make the changes today and review Mr. Davidson's progress in a week.
I'll set up a meeting with Mrs. Davidson to discuss support resources and follow up regularly to ensure she gets some help that she needs.
Great collaboration, everyone. So let's meet again in a week to review Mr. Davidson's progress and make any further adjustments. Thank you.
Thank you.
Thank you.